Meeting to order. Are we good, Rachel?
We're good.
So, I've been a commissioner now for coming up on 10 years. I do not recall the Fairfield County Board of Commissioners meeting an emergency session over that 10-year period. At approximately 11:59 this morning, I received a message from CEO Jack Donoso with the Fairfield Medical Center indicating that the virus and Fairfield Medical Center's ability to handle the patients associated with that virus was potentially compromised and challenged at this point in time. Since that initial notification, I've been involved in a great number of teleconferences and meetings throughout the day to try to make sure that I and the Board of Commissioners had a grasp on the magnitude of the situation. And so for us to better understand that situation, and perhaps more importantly for the community to better understand that situation, we thought it was imperative that we have this emergency session. Just for those who are participating virtually, I want to make people aware of who we have here in the room in a socially distanced environment. My colleague, Commissioner Jeff Fix, is with us tonight. Commissioner Levesey participating virtually. We have our County Administrator, Dr. Carrie Brown, County Emergency Management Director, John Cochis. We have Larry Hanna with the Health Department. And Stephanie, I'm going to get your last name wrong, so.
Fife.
I'm sorry?
Fife.
Fife. We also have Dr. Abby, the Director, I think I'm saying that title right, Health Commissioner. We've got Dr. Murray, Infectious Disease Specialist from Fairfield Medical Center, CEO Jack Donoso from Fairfield Medical Center, and Dr. Renee Wagner also from Fairfield Medical Center. So, and then I don't know the number, but some large number of people who are joining us virtually. I noticed there in one of the pictures I saw there that Mayor Scheffler is with us from the city of Lancaster. And then also just to let folks know that I did have an extended conversation with Mayor Gray from the city of Pickerington today. So we appreciate everybody being here and those that are joining us virtually. I have some strong thoughts and feelings about what brings us here tonight. I'm going to defer, which is highly unusual for me, to start until we have an opportunity to hear from Fairfield Medical Center about the situation. But first, if I might, I'm going to give my colleague, Commissioner Fix, an opportunity to make any opening remarks that he deems appropriate.
Thank you. Yeah, these are troubling times, obviously, and I think we've all been kind of riding the wave of the coronavirus since March of this year, and I think, like a lot of folks, we kind of thought it would come and go, and here we are in mid-November, and it's still here, and it's getting worse. Kept hearing about the second wave that was going to come all summer long, and hoped that it wouldn't, and here it is, and so I think it's time that we hear from the experts, what the situation really is and what we all need to do. I don't want to say that folks haven't taken it seriously, because I think a lot of folks have, but I think it's time that everybody steps up and does their part, and I'm interested in hearing more about what that looks like tonight as well.
Thank you, Commissioner Fix. Dr. Brown, any opening remarks?
I would say that from a county perspective, we have been communicating regularly about the very important safeguarding measures. We've been talking about how you can stay home if you can, and we've increased our teleworking efforts and have been encouraging other employers to do the same, to isolate when you're exposed, keep those distances more than 6 feet if you can, wear your mask, keep those hand washing up. We've been doing a lot of communication along those lines, and we'll continue to do that. And today, perhaps we'll hear something else that we can communicate about even more so beyond those safeguarding measures, and are eager to help.
So, CEO Jack Genoso, by the way, just so y'all know, when we operate in these virtual meetings, we try to identify people before they speak so that those who are participating virtually are not confused about where they're getting their information from. Next, I'd like to hear from Jack Genoso, the CEO of Fairfield Medical Center. You kind of sounded the alarm today, and I'd like to have the Board of Commissioners better understand why you did that, and the community at large perhaps understand why you did that.
Thank you, Commissioner Davis. I'm Jack Genoso, CEO of Fairfield Medical Center. For the last 8 months, we, like all of you, have been watching this pandemic unfold across our country and into our community. This has been a very imperfect process for all of us. We've learned every single day from the beginning of this pandemic as to what to do, how to do it. We've worked very collaboratively to try to figure out how to get the right equipment, how to prepare for surges that didn't come. I think that probably did us a disservice in a lot of ways, because I think we underestimated what was going to happen. The first surge we saw in the middle of the summer was significant in the fact that we had a lot of high acuity, a lot of deaths. Our staff were never built to see patients come in, quickly decompensate, and die as rapidly as they were, and we took that very seriously. Unfortunately, as this pandemic plays out, the fatigue that's on all of us as human beings is beginning to cloud something that made me realize today that we needed a different response. The trends that we are now seeing in the organization are to the point where the same staff that were providing care back in March are still the ones on the front lines providing staff care today. But the problem is that they are exhausted. They are worn down beyond what we could normally lift them up and keep them positive. I am a very optimistic person. I'm driven by optimism, and I'm not a panic-driven person. But what alarmed me today is that literally we've exceeded our surge plan. We have beds available at Fairfield Medical Center, but I no longer have qualified staff capable of spreading themselves that thinly across the organization. That's not a function of poor planning. It's not a function of anything other than the duration of this event is way longer than any of us anticipated. And the trends that we are now seeing are particularly alarming, so I do have some information I'd like to share with you. I'm not sure which way to click, if at all. There we go. Back one up. So we anticipated an increase in the numbers of tests. One of the things that you will see tonight is that the numbers we're sharing with you are not Fairfield County. One of the early arguments was that that's being skewed by Pickerington data. That is not the case. These are the testing numbers that come through Fairfield Medical Center only. So I can't speak to what's happening in the northwest part of our community, but anybody who chooses Fairfield Medical Center, these numbers represent. Typically on an average day for the last duration of the last 7 months, we've seen on an average 100 to 120 drive-through tests, with usually a positivity rate of about 6 per 120. So you're talking about a rate of about 4 to 5%. Over the last several weeks and months, actually, we have seen, this graph goes from October 1st through current date. The red bars on the top indicate the number of positives in proportion to the number of tests. And you can see some days we've had acutely higher numbers of tests. But what you'll see in the last 5 to 7 days is that the proportion of positives to the number of tests being given is significantly higher, which means patients are now presenting not just as persons of interest, they're presenting as being COVID positive patients who are decompensating to the point of needing hospitalization. Our staff are at a point now where we do not have enough critical care people to accommodate the number of patients that are beginning to come into the hospital, be cared for, being discharged, they're released. Today we had 6 beds released, and within 2 hours they were full again. We're at a place right now where we can't even send patients outside the community because all of our colleagues in Central Ohio are experiencing the exact same phenomena at the same time we are, and that is one of the reasons why I'm very concerned. Usually we could work with the bigger systems in Columbus, and if we run into capacity concerns, we could flow and ebb. We are now talking to folks like Hocking Valley every day to see if there's less acute patients we could send to them so we could take more acute patients. Regionally, we've been doing this for months. John will tell you, we talk almost every day about PPE, capacity, ICU usage, ventilators, all the things that you hear on the news. But what I'm telling you is that what we're doing in the community right now is failing. There are practical things we could be doing that we're not doing enough of, and even though some of us are doing them, we're not doing them enough in total as far as the community's concern is to make a difference. My staff are at a point now where there's very little we can do other than encourage them to come back the next day and do it all over again. Every day feels like the first day of the pandemic for them. You have to understand, it doesn't matter whether this is a second wave, third wave, sixth wave, they're the same people. I'd have no relief factor for those folks. And if I don't advocate on their behalf, when they fail, we're all going to suffer. What's essentially also happening right now is that what we're seeing is community spread. So this is important graphically, but what's really most important to see, well, there we go. You can see the trend, and the trend is pretty pronounced. Every day isn't a complete overwhelming day, but trust me, there are enough days with enough patients who last in our organization long enough that the bed turnover is not significant enough to handle the continued growth. If I move to the next slide, we're seeing a shift from tests being ordered for procedure screenings to tests being ordered for PUIs, patients under investigation. So people are no longer just screening to see if their symptoms are aligned with COVID. They suspect they have full-blown symptoms, and we're seeing the positivity rate confirm that. So here's the other really important thing. This isn't coming from a convalescent outbreak. These are coming from the community. And what's different about that is it's happening across our region. It's not happening here. So we have very little relief factor involved now. I can't send my troops to take R&R for 2 weeks and send in a new crew of people to take their place. These are the same people day in and day out caring for these sick patients. And I'm greatly concerned that as we head into the holidays, we're talking about even more cohabitation, more family gatherings, more events, more things that people are trying to do in a socially distant way that aren't really socially distant or safe. This number is going to become untenable. And there is a point where I can no longer take an additional patient without putting them at risk if we don't have the proper staff to safely care for them. And that's the point where we're at today. So if this gets worse, we're in big trouble. And that's what spurred me to call the commissioners today to say, look, we have a problem. So I'm going to let Dr. Murray talk about what we can do to maybe start seeing this trend change.
So we already heard earlier that there are a lot of things that we've been kind of encouraging people to do. We all know that we should wash our hands or sanitize them with hand cleaner. We need to try to avoid, as hard as it is, touching our mouths, nose, and eyes with our hands if they're not clean. And it's really important that we practice social distancing. And we've noticed this even in our facility. When you ask somebody to do this, maybe for a week or a month even, it's maybe not that hard to do it, but we're asking people now, it's been 6 or 8 months, and we're telling them that it's gonna have to be done for the next 6 to 8 months. And it's really hard to sit and have lunch by yourself, because if you take your mask off to eat, you can't sit within 6 feet of other people. All our break rooms are much smaller than probably 2 of these tables. So it gets really hard to do this after a while, but it's really important that we all kind of get back on the bandwagon to make sure that we are doing that whenever we can. Being around sick people, or if you're sick, going to work or going to activities is another way the virus spreads, and so it's super important that if you feel ill, that you get evaluated. Jack showed the lines of the tests that we have coming back. And, 2 months ago when we were at 5% positive tests, you might not have COVID if you got sick. It might just be allergies or something. But 1 out of every 5 tests we do at the hospital now is positive for COVID. So that means that there's 5 times as many people that are testing positive than there were just a few weeks ago. And when you have that many people, that many infected people out in the community, it's much more likely now that if you get sick or you feel bad, that you have COVID. So I would say, get yourself tested and stay home if there's any idea that you could be ill in any way. You're just harming the people that you're going to be around. And then, of course, we all should be covering our cough and cleaning our hands. And really, I know there's a lot of controversy, concerns about wearing face masks, but face masks do work. They are safe. And I've been wearing one basically almost daily for 12 hours a day since this all started back in March. So far, even though I see every single patient who comes into Fairfield Medical Center with COVID, I have not been ill. And I believe that's because hand washing, protective equipment, and monitoring your health really do work. Not to be alarmist, but I would say our house is currently on fire, and we all need to get the fire out. And the way we're going to get the fire out is by practicing these components. And one of the other things we're really worried about because of the time of the year is the number of holidays coming up where people are going to be gathering together in groups, multiple families, potentially magnifying the spread even more of the virus, and then traveling back home and taking the virus where they're at. And we really need to get that under control.
Dr. Murray, if I might, I reviewed a couple of studies throughout the day today, one from July out of, I believe it was England, and then another that was announced as recently as October 30th out of Texas regarding the mutation of the virus and the likelihood that it is now more contagious than it previously was. And I just wondered if you might comment on the possibility that the surge that we're seeing now is in part related to a mutated virus that is more contagious than the surge we saw in March and April.
So I think that it's not entirely clear if that's the case, but I think the virus can mutate, and clearly there is something driving this dramatic increase in the number of cases that we have. And so I don't want to put too much blame just on a change in the virus, because I think that some of it is just fatigue, because we need to be doing the things that we should in order to prevent the spread. And actually, those are probably even more important if the virus has made a change like they suspect. Yes.
Thank you, sir. Please continue.
Okay, I'm not sure.
Oh, just the, yeah, it's usually the right.
Oh, I'm sorry.
Oh, you're doing it?
No, you're doing it,
Oh.
but I click away.
Oh, okay, I'm
There you
sorry.
go. There you go.
So we talked a little bit about this. So face masks, they don't have to be a medical grade face mask. They could be a scarf. They could be just a homemade mask. The more layers you have, probably the better it works. But of course, the harder it is to wear. And it's got to fit over your nose and mouth and chin in order to protect you from any virus that might be in the environment. I'm actually talking really loud through this mask right now. If I didn't have it on, I would actually be, spewing particles out. So wearing a mask when you're in close contact with other people is really important to prevent that spread. And so even though we're socially distanced in this room tonight, that's why we're all still, for the most part, wearing masks when we're in the room. Of course, the mask itself can become contaminated with things. So if you touch your mask, your hands are dirty, you need to get them washed before you touch your face or anything. And then laundering it regularly if it's a cloth mask is also important. So we already talked a little bit about this. It's really important that if we think we're sick or our kids are sick, that we don't go out and spread the virus to other people. And it is true that probably 80% of the people that get COVID have no or minor symptoms and they get along great. But right now, we're seeing a lot of people, they're in their 40s, 50s, and 60s. They have at least one or so other medical problems and they've gotten exposed to the virus and they don't do well. They get sick and they come to the hospital where it takes a long time for them to get better. Some of them don't get to go back home. They end up in nursing facilities so they can do rehab, or, of course, not a small percentage of those patients actually die. At least 20% of the patients admitted to the hospital with COVID will die of their COVID infection. So we, of course, know that nationally, about 240,000, almost 250,000 Americans have died in just the last 6 months. So although for most of us it will be more of an inconvenience, we have to protect all those other people that could get sick and die, and they're also the ones that are going to end up in the hospital where we have somewhat limited resources, honestly, like Jack said, to deal with this. If you are not just sick, but you're really sick, you're short of breath, you have chest pain, you are confused or your family member's confused, then you should, of course, get the person to medical treatment like in an ER and not just stay home. But it's really important that if we think we're sick, that we take precautions. So community gatherings, we talked about this a little bit, are going to be probably one of the big drivers of COVID. Again, the COVID is not coming from a specific nursing facility or group home or from the hospital. The people that we're seeing and even our own employees are getting COVID out in the community. I read today that the Cleveland Clinic has over 300 of their employees off because they have COVID. That is a huge number, and no health system, even as big as they are, can stay up to speed or take care of all the sick patients there are when that many people are getting ill in their center. And it's from community spread. It's not because we track every exposure, and it's not coming from in the hospital. It's coming from the community and being brought in.
Dr. Murray, if I could add on to that, that's one of the reasons why I called commissioners this morning. When our staff begin to be compromised by community spread, I can't guarantee they're going to be able to show up for work to take care of people who really need them. As a matter of fact, we have a very close colleague who's worked day in and day out with us every single day, managing the units that oversee our COVID patients, who was exposed from the community, has been off for work for 2 weeks now, being quarantined. Those types of critical absences hurt the organization, they hurt the community, and it's not because we don't want him here, it's just that he feels responsible to ensure that he's not going to come here and make more people who need to be healthy unwell. So our concern is that our very limited, very constrained, very worn down base of personnel who are trying to do their very limited best are being exposed in the grocery stores, they're being exposed in the gas stations, funeral homes, restaurants, community events. And we have to do a better job in this community of trying to say masks are required, but making certain people in your facilities and your establishments are wearing them. This isn't political. I could care less about politics right now. And quite honestly, we just have to do what we have to do, because if the fire's burning in our house, you can't keep calling the fire department and expecting them to put it out when they'll eventually quit coming because they'll be exhausted. And that's exactly the point we're getting to.
Jack, if I could ask you a question, Steve Davis. I want to understand your staffing situation. I understand that you have some folks in quarantine and some staff members that you cannot currently rely on. But in broad speak, in terms of your employment base that runs the hospital, are you at full staff? Are you furloughed right now? Do you have people laid off? I mean, what's the situation in terms of all hands on deck, or are we just most hands on deck?
Commissioner, this is Jack Chinoso again. Commissioner Davis, we've never laid off anyone at Fairfield Medical Center. Through the worst of the pandemic for us was the beginning, where we expected this massive surge and no one was in the parking lots. We literally went for a month and a half with no patients. At that point in time, many businesses like ours who were shuttered or had their business remanded did what they needed to do to keep themselves in existence. We offered furloughs to employees who chose them, but at the current time, we have no one on furlough. We have put everyone back in their clinical care roles, and as recently as last week and this morning, we begin to call people out of their workplaces that have clinical acumen who could come in and help and provide relief. But we never have laid off anyone. We're constantly hiring, but the RNs or us store isn't right around the corner. It takes a good 6 months to bring in a new RN or a new staff level clinician and get them oriented and up to speed, if you could find them right now in our market. So the problem is that it's not that we don't want to get help. It's just that help isn't, it's going to take a while for additional troops to get here, and we're working on that each and every day. But our staff are being very patient. They're working extra. They're covering shifts. They're moving floor to floor. They're helping any way they can. We have stretched our agility as far as it can possibly go, and that's the reason for the call today, is that we're at that breaking point where if this gets worse, we have more beds we could staff. The problem, or we have more beds to fill, but we don't have the staff to fill them with, and that's the problem. Because what's different today than it was 6 months ago is that we're not double occupancying anybody. Because how do you put a patient with a general acute illness and a patient with a COVID suspected patient without making them both ill? So right now, every room is a single occupancy room. That means we're still seeing surgical patients, we're still seeing acute heart attacks, we're still seeing stroke patients, we're still seeing other general illness. It's different than it was in the beginning when everything else got shut off and all we were waiting for was COVID. So when you bring the whole community need to the table, it's really beginning to jeopardize our mission. We are willing to do whatever we can do. I've offered to do whatever makes sense to our clinicians. I unfortunately am not a clinician. I offer them zero value other than to feed them. And I would be happy to do that if that helps. But the bottom line is that we are at a point where if we can't get some relief from the demand side, the supply side is running thin.
And if you'll just give me a moment here, I don't want to interrupt your presentation, but I also want to see if my colleague, Commissioner Fix, has any questions at this point. The presentation will continue for either Jack Donoso or Dr. Murray.
Not yet.
Dr. Brown.
I'm just hoping that we could share the slideshow and tweet a little bit later as well, if that was okay. Because there are a couple of questions in the chat, and I think if they could see the slideshow, that would be very helpful.
Please, it's yours to share freely.
I'll have WebCheck put it on our COVID page and we'll tweet it from there.
All right, gentlemen, please.
I'm not sure if there's another slide. Okay, so just a few tips because we are going into the holidays about gatherings. Be proactive. If you have family members that are sick, really don't wait for them to tell you they're sick. Tell them, remind them to stay home. You don't want them in your house or your gathering because they're just going to make people worse. Again, encourage small numbers if you have to have a gathering so you can socially distance. You might even consider wearing masks when you're not eating. Again, hand hygiene can't be overemphasized. Neither can cleaning the high-touch surfaces where people might have their hands or might spread virus on. And then one of the other things, especially if food's being served, it's important maybe to limit somehow the number of people that might touch the utensils to serve the food in order to decrease the risk. And this is just, we'll post the presentation on the website, but this is a list of possible references that people might get additional information if they're interested in that. So with that, I'll turn it back over to you.
Thank you, sir. I wanted to also have Larry, Hannah, and Stephanie Fife. I know with the recent surge in cases and your capacity to trace and try to inform people as to their potential exposure, and I wondered if you might touch on the impact that's having on your ability to do your job right now and what you're seeing from the health department standpoint.
Sure, thank you. Again, my name's Larry Ham. I'm an administrator for the health department. As we all know, we're seeing a large surge at this time. It's greatly affecting how we're able to do contact tracing. Actually, right now there's so many cases we can't keep up with the cases. We're probably close to 200 cases behind at this point, and it just continues to grow daily. We can't keep up with the release letters when people come off isolation and quarantine so they can go back to work. I don't know how many calls we have a day on that, but we just can't keep up with it. People are not cooperating with us. When we call and need to quarantine or isolate someone, they do not cooperate. They're fighting us on that, and it's very frustrating. It was bad 3 months ago. It's even worse now. Parents argue with us when we have to quarantine their child. It's very frustrating for staff. And as far as staff, I heard Jack say how exhausted his staff are. My staff are just exhausted. I don't know how they keep going. They've worked 125-hour weeks for months and months and months. It's just exhausting what they're doing. We have to make numerous attempts to contact people when we're trying to call for contact tracing. Folks are just not cooperating with us. We're so far behind. Today we spent several hours and we worked on a prioritization plan as far as moving forward. The prioritization plan will focus on healthcare workers. They'll be our highest priority. People in long-term care, first responders and things like that. I think that's going to help us. I don't know how fast it will chip away at our mound of people that have cases, but I think it will help us moving forward. We've also come up with, Stephanie's also come up with a new intake, a case investigation form that's considerably smaller and more condensed than what we were using just a few days ago.
So I guess, I'm listening, Larry, I really am, and I'm empathizing. I mean, I guess I catch myself wanting the community to hear a word, I guess, about today's news from Pfizer. I mean, that's encouraging.
Absolutely.
That's some light at the end of the tunnel.
Absolutely.
And I guess that when I think about that and I hear these presentations tonight, I kind of want people to feel like there's a window here, between where we are now and where we're trying to be. And so, unlike March and April, when we begged folks to do all these things we're asking them to do tonight, we're doing that now with some real light at the end of the tunnel, and a window here where we're begging people to do these things and to comply with your requests and to give us a chance to fight back against this capacity problem. I know a lot of folks talk about mortality and they want to say, well, it's not that big a deal because not that many people are dying. We're not talking about mortality right now. We're talking about treating sick people who are arriving at the hospital and our capacity to do that. So I want to just, for all I'm worth, ask people to look at this as a window in time that if we can fight our way through this moment, I do believe there's light at the end of the tunnel. And of course things are going to be okay because things are always going to be okay. But I didn't mean to speechify there, but it's just that's where I'm at in my heart right now. I just feel like we're right there on the 20-yard line.
I'm with you. I'm completely with you. I feel like we're driving down this road and there's a fork up ahead of us, and we're right up at that fork. If we go down the wrong fork, bad things happen at the hospital. If we go down the right fork where we do all these things about wear masks, social distance, stay home if you're sick, that vaccine's there for us. And it's going to be a lot easier path for us.
I interrupted you a little bit and kind of given the Board of Commissioners and the community a sense as to kind of where you are in this fight right now. Did you have additional information on that?
Where we are at.
Yeah, do you have additional information you think would be helpful for us to have right now?
I can tell you, and Jack and Dr. Dagmurray's already spoken as far as the positivity rates, which is what's really important, but I can tell you just as far as us trying to handle cases in the health department, for the whole month of October, we had approximately 879 cases. And just so far this month, we have had 585. So our staff, we are trying our best. We've been very proud to be able to keep up with and contacting people within 24 to 48 hours. That has been a pride thing for us to do for our community, and we just can't do it anymore. The best thing that we have are all these precautionary measures and contact tracing until we can get the vaccine, until we can get that vaccine campaign started. And I do believe that we are seeing that coming, and we just need people to hang in there, continue to really focus on doing these measures for just a little longer until we can get to that point. I know holidays are important to everybody, but there will be more holidays, and this year we have to figure out different ways to be able to celebrate, maybe just not in the same household. We can give it to our family that doesn't live in our household and our friends. We can transmit it that way, and I think people have kind of fallen back as that being a safety measure, that you're part of my family, so we're okay. We're friends, so that we're okay. We're not okay anymore. we can get this from anybody at any time.
And I may come back to all the members that have joined us here so far, but I want to make sure that I give an opportunity for my colleagues to inquire as well. First, I'm going to ask, I don't know how that happened. I'm going to ask if Commissioner Jeff Fix has questions, and I'm going to say for this point, specifically for the Health Department.
Not for the health department, no, thank you.
Dr. Brown.
Larry and Stephanie, are you still hiring any contact tracers?
Yes, we are.
We are.
Can you maybe take this opportunity to let some folks know what you're hiring, if they can work from home, the kinds of things that might make this opportunity a bit attractive to perhaps somebody who might be listening in?
So what's really important with this position is interviewing skills. It really is vital to this, especially during this difficult time. Sometimes these conversations can be very difficult. It's not just easy as reading a script and writing down some answers. It really is an investigation, and it actually is it's very interesting to be a part of this during this time. We need you to have telephone interviewing skills and computer skills. Those are the big things. And if you have any kind of a medical background at all, that is also very helpful.
Can you work from home?
Oh, yes, sorry. Yes, ma'am, you can work from home.
And how much does it pay?
You're starting at $18 an hour right now.
Yes.
Okay, that's a little bit of a lift from where you began. That's good to hear.
So those are the positions that we would have, yes.
And how long will it go on?
For as long as we do contact tracing, 6 to 18 months.
Okay, okay. And how do they contact you?
We have a job posting on our website, myfdh.org.
Is that the only way to contact you?
They
Can
could-
they also email
Yes,
you
sir.
or
Yes, email
call
us as
you?
well.
Yes.
We're gonna post that and tweet it so people can perhaps maybe reply to that and plead for help too.
Thank you.
I do have.
Commissioner Jeff Fix is horning in.
So, as I'm out and about in the community, the place that I feel most at risk is when I'm walking into or out of a business, be it the grocery store, the gas station, or a restaurant. And I'm wondering what tools we can provide to all the small business owners all around Fairfield County so that when someone walks into their business without a mask, they can offer them a mask, or they can politely ask them to put on a mask. I mean, I'm just not seeing that. And as a small business guy, I get that you don't want to piss off your customers by requiring it or being demanding about it, but there are positive, gentle ways to remind people that we are in the midst of a pandemic, and you're risking putting other people at risk by choosing not to wear a mask, right? So I'm wondering if that couldn't be part of our education process, because people are going to have Thanksgiving. People are going to have Christmas. I got a wedding in January. My daughter's getting married. I'm going to it, right? Those things are going to continue to happen. But if, as we're out and about in the community, going in and out of those small businesses, there's that constant reminder there, and the ability to grab a mask off the counter and put it on for that 5 minutes that you're standing in line at the gas station, or for that half hour as you're walking around the grocery store. I think that would be a step. There's no silver bullet, but that would be a step. I think that would help.
Dr. Murray, I'll give you a chance to comment on that question or comment from Commissioner Fix.
So we definitely, masks are very helpful, and I think you probably have to pass them out. You wouldn't want them just sitting out. We spend a lot of time at the hospital. Every person that comes into the hospital doesn't just get told to wear a mask. We also ask them a bunch of questions. I don't think I would do that at a business, but it's important for the employees to have some scripting or some kind of practice what they're going to say when they have to encounter that person. And I think if you have to do it kind of off the top of your head at the spur of the moment, it'll just be easier not to do it. So I know our group that kind of manages those temperature takers, they're the first people see when they come into the hospital, have spent time trying to kind of help them have some talking points and things like that. So something like that might be helpful to get out to the community as well.
Jack Janoso.
Thank you, Commissioner. You know, to Dr. Murray's point, one of the most abused persons in our organization at the current time is our front door temperature takers. I've had direct feedback from them that they're getting challenged daily by people who refuse to have their temperature taken, refuse to wear a mask. We've had to take the stance that our business is neither a democracy or a republic. It is a business, and we have an obligation to keep ourselves and our employees and each other safe. And you know, I think at some point in time, we're going to have to stand up as a community and say, look, if you can't abide by our needs to keep the community safe, then you may have to take the chance on having somebody walk out of your business pissed off. But honestly, this isn't going to abate itself. We're not going to get to the point of an effective vaccine if the safety nets of this community start to falter because we're not doing the things we need to do. It's not the easiest thing to say in this moment. It's not the thing people want to hear, but it's what they need to hear.
So if I might, I'm sorry, Dr. Brown.
We have some tools that we have from the CDC side that are some signs that you can place on your front door, and they're very effective. And also Angela Cryle from Cryle Communications completed some and provided them to the chambers just in case people want to use those that are signage that you can place. And one of the most effective ones, just I can speak personally, that I really appreciated of the sign, it said kindness equals a mask. It was in pictorial format, and I thought that was a really good way to just, in a couple of sentences, just, you know, mask required, kindness equals mask, and who doesn't want a little kindness? So it was a way to kind of change the thought process. And then the other thought is sometimes people think it doesn't matter. I'm wearing the mask, but it really doesn't matter. And there's a lot of evidence out there, and it's posted on the CD site now, that shows how wearing a mask, doing those safeguarding procedures, and things like teleworking and shift work as well, it is mattering. And communities where that is well received and used regularly are having lower incidence of the virus itself. So that's on that CDC site. John and I were just talking about that last week. John's already tweeted that out. But for those who think it doesn't matter, it does matter. And maybe if you just shift your thinking, is cognitively this matters and it's equal to kindness, that maybe that's a way to think about it in terms of those who might not be put off, you know, who might be put off a little bit in terms of wearing a mask.
So I'm going to go to John Coaches here in just a moment for an update on personal protection equipment. But I wanted to just say to the community, if you're listening to us right now and you're thinking, I have heard this for months now, I know that, it's all the same old, I just want to tell you for all I'm worth, this is not March, this is not April. These numbers are worse. And our hospital is at the point of breaking from the standpoint of its capacity to treat the folks that are suffering from this virus. So we're in this window right now where we need you all to help us help you, to make sure that those folks that need treated at Fairfield Medical Center will have that opportunity to get that treatment, which is being very successful right now. So I know that some of what you're hearing tonight, you're feeling like we're beating the drum. But I just, for all I'm worth, I want you to know this is not March. This is November, and it's worse. And we're in a situation here, and we're asking, we're begging for your help in this fight. John Coaches, where are we in terms of our supply and provision of personal protective equipment for those businesses and entities that need it right now?
Yeah, thanks, Commissioner. So our job in this response is to support those supplies and logistics that are needed. PPE has been the one that's most been talked about. We've almost passed out more than 750,000 pieces of PPE just in Fairfield County alone, and that's to Tier 1 healthcare. That's not to the business community, the commissioner's offices and departments. That's more that we've also been able to do. It's still probably not enough to keep everybody in a full, complete supply. We're still seeing congregate centers needing PPE from the suppliers. This is a nationwide problem. So while there's hope and things like that, we need to make sure that we're continuing to support all of our healthcare partners and their PPE, and we're trying the best we can with the resources that are coming from the state and federal government. But it's a big task. It's a big haul. But I think more concerned to me, and I think you've heard it over and over again, is the resource of personnel. We see responder fatigue in frontline healthcare with the health department. In our long-term care centers, where these staff members, make nowhere near the average in the healthcare industry, and they're on the front lines and helping our seniors get through this pandemic. They're dropping like flies. We really need to understand that early on in this pandemic, we saw New York City receive mutual aid nurses from all across the U.S. No one's coming in. So each individual area is on our own because we're all affected. Central Ohio is greatly impacted. We currently have numbers that I have not seen throughout the pandemic. Currently, inpatient admitted to a hospital with COVID. It's the highest it's ever been, all across Central Ohio. So, we want to continue to support PPE. We're getting that assistance from the state and federal level, but there's still a lot to go, and we need to make sure that people give us as much breathing room as we possibly can by, respecting the social distancing, mask wearing, and hand washing, very simple things, and just giving it a try. I saw a podcast today that kind of compared it to, World War II England and being bombed, right, Blitz. And they responded as a community, as a society for 4 years. And they lived in basements and everything else. We're just asking people to wear a mask and wash their hands.
Well, and I guess, we've heard from a number of professionals tonight, and we're going to hear from more, but from an analogy standpoint, this is just my take on it. I'm not a specialist in any of this stuff, but I feel like the train's going off the tracks. All we're dealing with now is how many people are going to be on that train. Dr. Wagner, I appreciate you being with us here this evening. Dr. Renee Wagner from Fairfield Medical Center. I wondered to myself if there was a thought or a vantage point or a contribution that you'd like to make to our conversation here that we're trying to have with the community tonight.
I want the community to realize that this is real. This isn't New York City. This isn't Arizona. This is Fairfield County, Ohio. I'm not an infectious disease expert, but I see what's happening at our hospital. Today we had we currently have about 19 beds designated to treat COVID patients. This afternoon, we had made 5 beds of those available by discharge, et cetera. And by the time I came to this meeting, those beds were probably filled because we had 4 patients in the ER that were probably going to be admitted to those beds. We have to keep the number of patients that are affected with COVID down so we can successfully treat them, minimize the risk that the spread will more profoundly affect our community. We have not even entered into flu season. We're starting. And I can't imagine the COVID issues that we have now with the limited staff and compiling flu on top of that. You can never tell how bad your flu season is going to be, but if it's anything like some of the years in the past, we're going to be in dire straits. And I want to make sure that you understand it's not that we didn't staff up, and it's not that we were twiddling our thumbs thinking this was going to go away. We have adequate staff, but staff was in a community, the disease is there, so some of our staff are getting ill, and like John said, there is not staff or traveling staff nationally to respond to this pandemic because they're all tapped out.
Thank you, Doctor. The Commissioner's Office has received a fair amount of money from a CARES Act standpoint. We have tried to find ways to be helpful to the health department and to the hospital with respect to those funds. As far as from my limited knowledge and awareness. I feel like we have two things from the commissioner's office. We have money, and knock on wood, right now we got a lot of it. And we got a megaphone, which we're trying to contribute to the discussion here today. But I want to start with you, Jack, and I want to give everybody an opportunity to contribute to this question. What more? What else can the Fairfield County Board of Commissioners do to try to help you, help us at this critical time when you're facing a capacity problem and your ability to treat the sick people in this county?
Thank you, Commissioner. First and foremost, thank you for all the support you've given us, because giving us the tools to do the job matters. Our first fight was with PPE. Do we have what we need to do the job? Our ongoing fight remains with testing, adequate, rapid testing, so that we can take care of patients more quickly, isolate them more quickly, figure out what's wrong with them more quickly. And the problem is that while we have access to testing, we don't always have access to the media that comes from the testing companies to provide the tests, and that's been our rate limiting issue. So some of the generosity of the county is going to help us amp up our testing capabilities so that we can do a better job of being able to isolate patients quickly. That quick isolation and determination helps us manage capacity differently. Instead of having to assume everyone's positive until we can prove they're not, we can quickly determine how they fit. So having the tools to do the job is one thing, but the most vital tool are our people. And the only way that's going to be preserved is by limiting the amount of community spread that's occurring through activities that feel good in the moment, but that have very unintended, rapid spewing consequences. And what I'm saying is that if the commissioners and the mayor and the like can help us, we have to be more resolute on not letting super spreader events occur in the community. I'm not saying remand business. We don't want our business remanded any more so than any of you. We count on your businesses to thrive, so we thrive as well. But what I'm saying is that all these special events, community gatherings, unfortunately, one of the few external responsibilities I now currently have is going to funeral calling hours for people that we know that are close to this organization that are passing. I've been to many calling hours in the last several months. I felt highly uncomfortable going to them. We have to ask people who run their private businesses to pay attention to this and do it in a way that's safe for them, doesn't kill their businesses, but we've got to use better common sense.
So, Jack, you mentioned something, and I want the community to understand this, that there's nothing about this meeting from the Fairfield County Board of Commissioners standpoint that's talking about lockdowns or closing restaurants or prevent businesses from doing their business. Everything about this meeting is to allow that to continue. That's where our heart is. That's what we want. But when that next patient comes to Fairfield Medical Center and can't get service, and the Columbus hospitals are overflowing and won't take them, we can't be there. We're trying to avoid that. Dr. Murray, my question was, what more? What else can we be doing to be helpful to you in this situation?
So I think the testing is a big thing. And then I was just got a message to remind the businesses that the hospital website has information on how to manage some of the business side of COVID. And then, I think the other thing we kind of talked about a little bit, which is going to be coming, which we got great news on today, is the vaccines. And even at the hospital, where we mandate the flu vaccine every year for our employees, you have to get it if you work at the hospital because we know it works. It keeps people safe. Probably half the employees don't want to get the COVID vaccine, at least right now. But we need to start getting information out about that because it's going to be a huge undertaking for the health department and the county and the hospital to get the vaccine to people that will take it. The other thing is the information about it. The vaccine actually had studies that had 40,000 people in it. That's the same amount as every other vaccine that's ever been released and approved. It's going to go through the exact same approval process of every other vaccine. And there aren't too many other vaccines like for these kind of viruses that are 90% effective. That is amazing. That will be a game changer. But it can only change the game if enough people get it. And so if it really is 90% effective, probably at least half of the people will have to get it. So when it comes out, it won't be available for everybody at first. It's going to go to healthcare workers, first responders, et cetera. And I'm hopeful that as we kind of get information out about how safely they have been developed and the benefit, it's going to really truly be a game changer that people will, like, it'll be like some of those things that's sort of in short supply. Everybody's going to want it, which would be great. But it's going to be a big effort to get that done. I can tell you, I'm going to be in line. If I can get the first dose of the vaccine, I would be thrilled because I don't want to get COVID.
Thank you, Dr. Murray. Commissioner Fix, you had a question or comment?
Well, I've got two. We talked about the flu season, and I wonder if you can talk for a moment about how, if everyone got the flu vaccine, how would that improve the situation with regard to the coronavirus?
So the way it would help is, well, first of all, every year, usually in January, February, our hospital census goes way up because we have flu patients. And they come into the hospital. We know that the vaccine, the flu vaccine actually is only about 50% effective in a good year. So we know that lots of us have to get even more of us need to get vaccinated. And actually, the guidance is that everybody should get the flu vaccine if you're older than 6 months, as long as you don't have an allergy. And if we did that, then that could certainly help. We don't really know what the flu is going to do. It might be sort of, it might make people tune out about the flu a little bit, but when we started wearing masks in March, we were in the midst of a huge increase in the flu. And we all started to wear masks in the middle of March, and we had a shutdown, and the very next week there was no flu in Fairfield County. So maybe some of that, we're not going to shut down, obviously, so there's still going to be a lot of people getting out and around, but hopefully our masks will help, and the vaccine would help, and sort of the more people we can get, the better. There's no such thing as too many people getting the flu vaccine. The other thing is for yourself, if you get the flu, and people that get the flu know it's horrible. You feel like you got run over by a truck. It's not a runny nose. If you get the flu and then you start to get better and you catch something else like COVID, or people often get pneumonia, those patients don't do well at all. And so if you get the double whammy, which if COVID is rampant in the community at that point, then that could be really bad for everybody. The hospital's going to be full. The nursing homes will have it. And the other thing is people are just going to do bad. We had our first positive flu test yesterday in the county. So it's only one test, but it is like it does every year. It's starting to show its head already.
Thank you. The second question came from someone who's actually watching tonight, and it was around other preventative measures that people might take with how they eat. Are there preventative medicines that they can take? I guess the question was elderberry and things like that. Are there other things that are not necessarily old wives' tales, but things that can be done that normal people can do to prevent or enhance the chances of preventing getting the coronavirus?
So there's a lot of different supplements. I think sometimes they're driven by the people that are selling the supplements, so you have to be careful of those claims. But one of the things we're actually using at the hospital is there's a lot of evidence that vitamin D is important. And in Ohio, actually, I've never had a patient that wasn't on supplementation, so most of us aren't on a vitamin D supplement. I've never had anybody check their vitamin D level and have it be normal. We're all low in Ohio because there's no sun, and we all are inside all the time. So I know I take a vitamin D supplement every day, and I didn't start it with COVID. I was already on it, but I've really been encouraging all my patients, and we put all the people that come in with COVID on vitamin D. And it doesn't have to be a lot. You can just do, like 1,000 units a day. Some people will do 5,000, but because you can get too much, but you probably have to take an awful lot to get too much. So if you have a question, check with your doctor. But actually, vitamin D would be the one thing. And it's good for all kinds of viruses. It upregulates proteins that are called defensins in our body that help us prevent the infection. So that could be helpful to people too.
So I want to come now back to the health department, and the question that I want an answer to is what more, from the Fairfield County Board of Commissioners standpoint, can we do What is your ask? How can we be helpful to you?
I think the best thing we can do at this point is we can all just keep pounding everybody on the wear mask, stay home, social distance, things like that from this point forward. I think that's one of the best things we can do.
I think that what we need from you is something that money can't buy, and I think that is encouraging, having this open dialogue with things like this, leading by example in our community, and encouraging people in our community to do the right thing for themselves and for other people, most importantly. We're a close-knit community here in Fairfield County, and we need to do the right thing for everybody, and I think you guys continuing to send this consistent message out, I think that's one thing that you can really do as community leaders.
I want to speak to that. I want to speak to the community about this. I mean, you're talking about leading by example, and I want the community to know I come to you here tonight and every day as a sinner, not a saint. I have not been Mr. Perfect in terms of my own conduct and behaviors in this pandemic. I have not felt the way I feel tonight. And frankly, the way I felt all day. You know, I was comforted in recent months by the hospital's capacity to handle this situation. I am no longer comforted by that. So for me, that changes how I'm feeling about it. John Coaches, I want to come to you. What more can the Commissioner's Office do to support you as our emergency management director and the challenges that you're facing day in, day out?
Yeah, I think the next best thing that we're able to do is meet the governor's request for a COVID defense team. We've started that process. We have 135 respondents already based on other committees that we're gathering together, including the commissioners, and just supporting those ideas and helping us get more ideas into that group. We meet this Thursday. We're going to set up a very aggressive meeting schedule and get community folks together to help us get more awareness and get more understanding and more resources to fight the pandemic.
Thank you. So, as folks who have worked with me for years know, I have a pretty strong feeling that meetings that last longer than an hour lose their steam and their effectiveness. And so what I want to do is I want to give the folks that have been kind enough to be with us here tonight and share this information and this urgency an opportunity for any final thoughts that they think it would be helpful for either the Board of Commissioners or the community that's joining us tonight to hear or feel. And so I'm just going to kind of go this way, and I'm coming now to CEO Jack Giannozzo and ask you if you have any concluding thoughts along those lines of what other information you think it would be helpful for the Board of Commissioners or community to have right now.
Thank you, Commissioner Davis. I guess I'll just end with something very simple. You know, when people use the line, we're all in this together, that means something different to everybody. But I could tell you this very honestly, the people at Fairfield Medical Center really are in this for your betterment. We are coming here tonight to ask you for your help because we are becoming overrun. You've listened to us, you've heard us. But as leaders in our community, we have to respond with our actions, not our words. We are the recipients of your care. We will help you get better. We will do everything we can. But quite frankly, we don't want to have to be in a position to tell somebody that we can't care for their loved one. We don't want to be in a position to say goodbye to one of our loved and trusted employees or a family member. And this is serious. This is not a hoax. It's very real. It's in our community. And until we recognize that and move beyond the inevitable, we will get to a better day. I will be the first one in line for a vaccine. Dr. Murray and I will be arm wrestling for it because we are going to set the example that when we have better tools, we're going to utilize them. We want to get past this as much as anyone else. So thank you for your courage, thank you for your patience, and thank you for your attention to call this meeting together because, quite frankly, we owe it to our people to protect them. Whether they want to be protected or not, it's our obligation.
Thank you, Jack. Dr. Murray?
So we always end, we have what's called a safety huddle at the hospital every day. And every day Jack reminds everyone at the hospital to wash their hands. And so I would say wear your mask, stay 6 feet apart, and wash your hands. That's the most important thing we can do.
Thank you. Larry Hanna from the Health Department.
So I think my message is going to be the same as it's been since March. I think everyone, we need to wear our masks. It's just plain the right thing to do. As Jack said a few minutes ago, it's not a political thing. It's not an infringement on your rights. That's not what it's about. It's just the right thing to do, to wear a mask, to protect your family members, to protect your pastor at your church, your kid's janitor. It's just the right thing to do. And I'm going to leave you with the last thing I'm going to say is I watched I think it was the Wisconsin governor the other day when he said, just wear your freaking mask. That's what I want people to do.
Thank you, sir. John Coaches.
Nothing really too much further other than, we want to get some of these thoughts on video and use of PSAs. So I encourage anyone who'd like to do that.
The Commissioner's office is scheduled for each Commissioner tomorrow to do a PSA, and we'll be relying upon interface video and the services of Bob Competti to turn those around as quickly as reasonably practicable. I'm going to turn next to Dr. Carrie Brown, and just a footnote there. As the CARES Act funds were being guided and distributed in the Commissioner's office, Dr. Carrie Brown has been a magician in terms of how we deal with those things and making sure that those entities in the community that are most helpful to fighting this virus have the resources they need. I don't know what the Commissioner's office would have done without her skill set in this situation. Final thoughts, Dr. Brown.
John will tell you that at the end of every department head meeting, we have a series of questions we go through. One of those questions is, what have we done today to protect our community? So I think one of the things that we have done today is just try to get the message out again a little bit more and think about protecting, our loved ones, our neighbors. So that's what we've done today. And then tonight, after this meeting concludes, we will tweet some of that information about the contact tracing needs. We'll tweet about the hospital site for businesses to give them additional tools. And we'll also share that slideshow. We'll continue to do the public service announcements so that we can continue to be a good communication partner, both with our employees and for the general public.
Commissioner Jeff Fix.
Thanks. So we're a community of 155,000. And I'm thinking tonight about, the folks who are on this call with us and are here in the room, and the folks who may get a chance to see one of our videos, those who follow our Twitter account or check our website, and we may reach a couple thousand people. And if we're really, really good and have a really robust social media campaign, might reach 20,000 people. So the conversation I'd like to have tomorrow in our regular Tuesday morning meeting is what can we do differently to reach the other 100 and some thousand that won't see our videos or won't have participated in this meeting. There's a lot of folks out there that we need to reach that haven't yet clearly understood the message of how critical this is, and we need to figure out how to reach those people. So I look forward to that conversation tomorrow.
Thank you, Commissioner Fix. We have also with us virtually Commissioner Dave Levesey. Dave, can you hear me?
Yeah, I can.
I wanted to give you an opportunity to ask questions or make comments that you think it would be helpful for the community to have answers to or hear your thoughts on right now, sir.
My mic wasn't cooperating early on, but it is now. I'd like to talk about this perspective. Not only do I serve as a commissioner, but I also operate a small business which has a fair amount of foot traffic. And one of the things I found was that, you don't really ask people to put masks on. About 90% will. Maybe that 10%, is opposed to that. But if you have a professional signage on your door, most people adhere to that. And I think it would be helpful if there were a footnote from the health department on that signage and get that signage out to the public. I think that would carry a little bit more weight and be much more effective, because I think that if, there's very few things we can really do, but this is one thing that I think can be very effective. Thank you.
Thank you, Commissioner Levesey, and I appreciate not just that you're joining us here tonight, but the way you carry yourself in this community and on this issue has been a powerful force in the Commissioner's office, and I thank you for that. I want to give Dr. Renee Wagner an opportunity for any concluding remarks.
So we started this COVID battle at the hospital in March. By June, we thought we had a game plan, even though it evolved every day and changed every day. We expected the lull over the summer. We didn't have that lull. In fact, we had a surge. And this surge is, like Jack and you, Commissioner, it's different. It feels different. It feels threatening. It feels scary. And we're here as Fairfield Medical Center, and I'll speak for the health department as well. We're here to ask your support. We can't do this alone. This has to be a community-wide effort to protect our fellow man, to protect our patients from the respect of the hospital, to protect your constituents. And we just ask your help. We can't do it alone. It's real. It's in Fairfield County. And, we're in this together, so to speak. And we just ask your help and cooperation to allow us to serve our community.
Well, I thank you. Dr. Brown.
I just want to mention, I noticed that there are several questions in the chat box, and we're going to get those email contact information, and we'll make sure that the questions get to the right people so that we can try to provide answers, because it wouldn't be efficient to try to do that with the number of folks that are in the chat box.
I put my email address in the chat box, so they just need to email me their questions. I've already had one, and I was able to push it off to the right entity to answer that question.
So we will make an effort to get those questions resolved. And I guess in conclusion, I just want to share with folks that I know some of the information that's been conveyed here tonight seems like information that you've been hearing for a while, and I certainly appreciate that. Perhaps like me, you're tired of hearing some of that information. What I just want you to understand is that it's a different context now. It may even be a different mutated virus. I guess we're not clear on that. Some of the studies seem to suggest that it's more contagious than it was in the spring. And everything we can do at this moment to try to slow this spread a little bit in this community, to give the hospital a fighting chance to care for these folks, that's what we're asking. And the Commissioner's office will try to do better. Someone suggested to me today, hey, what are you freaking out about? You're in the same boat as everybody else. Well, doggone it, that's not how this Commissioner's office operates. Being in the same boat as everybody else is not good enough for us. Please, help us help you.
Steve, if I might, before we finish up, I do want to recognize Mr. Genoso and his willingness to reach out to us, to ask for support and ask for help. A lot of communities don't have those kind of interrelationships, and it's important to all of us that FMC is comfortable reaching out and asking for help. And so, Jack, I want to thank you personally for stepping up and asking for us to have this conversation tonight.
I would like to be clear about one thing. You've all been great community partners. I think there's been great intent, great focus, great intensity on trying to get ahead of this, but I think Dr. Wagner hit the nail on the head. This is different. We're reaching a point where all the effective things that we've done so far are no longer appearing to be effective, and we have to take a more diligent approach to this. We're not here to accuse anybody. We're just saying that if we really are in this all together, now's the time where we really have to make that matter. This virus doesn't care who it kills. It doesn't care what you believe. It doesn't care what happens. It will just make you sick or kill your family. And until we do the things we need to do to make it go away, it's not going to go away. So thank you for your patience. Thank you for calling an emergency meeting of this commission, because quite frankly, That wasn't the expectation. You superseded our expectations by just taking it this seriously. So thank you on our behalf.
Thank you. Final thank you. I want to get out there to Bob Campetti with Interface Video on short notice, who has been with us here tonight. Will be with us here again tomorrow to help us prepare some PSAs. We'll take some of the information that we've learned here tonight and try to convey that as powerfully as we're capable of doing. Commissioner Fix, I'll accept a motion. I've got a motion to adjourn in a second. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion carries. The commission is adjourned. Thank you all for joining us, and please stay safe.